Hello, how are you everyone? I hope you are having a great day today. My name is Sultan Magliah. I'm a family medicine resident at King Abdulaziz Medical City, Jeddah. It's my pleasure to you to give you an oral presentation about my research, which is titled Managing Type 1 Diabetes Among Saudi Adults on Insulin Pump Therapy during the COVID-19 lockdown. First, I would like to thank the organizing committee of the conference, second edition of the World Congress on Endocrinology, Diabetes, and Metabolism. So let's begin. So this is the content of my presentation. First, I'll talk about an introduction and background. Then I'll speak about objectives and rationale, methodology, results, summary, and conclusion. I'll start with an introduction. So as you know, the coronavirus disease 2019 pandemic has affected everyone's life. Countries around the world encouraged social distancing behaviors. Also, they enforced lockdown, especially at the early stages of the disease or the pandemic. In Saudi Arabia, the lockdown lasted almost 3 months from late March to June 21st, 2020. During this time, there was a transportation restriction, suspension of attendance to workplace, closure of malls and markets. So as you can see, all people's lives were affected during the COVID-19 lockdown. As you know, insulin pump therapy is one of the two common methods to deliver insulin to the body. It usually contains an insulin pump device, insulin reservoir tube, infusion set, and the continuous glucometer method, which could be a glucose sensor, or some people also use the old-fashioned way, the glucometer. So moving on to the objectives and rationale. So what were the objectives of this study? We wanted to investigate the impact of the COVID-19 lockdown on self-management behaviors. What do we mean by self-management behaviors? We mean maintaining a physical activity, ability to follow a healthy diet, monitoring of blood glucose, and adherence to medication. Also, we wanted to investigate the impact of the COVID-19 lockdown on maintenance of diabetes care. So as you know, there was two main big problems during the lockdown. We stopped the in-clinic visit and we started the virtual phone call appointments for the first time. Also, another problem was that the difficulty of getting the insulin pump supply during the lockdown, since there was a restriction of on transportation. So we wanted to see the impact amongst all the adults with type 1 diabetes using insulin pump therapy. Why we wanted to do this study? We wanted to deliver new insights to the literature on helping to provide optimal care for diabetes in this special population during times of lockdown. Moving on to the methodology. So the study was conducted in the adult specialized insulin pump clinic at King Abdulaziz Medical City, Jeddah in Saudi Arabia, which is one of the fewest institutes that provide continuous care for patients with type 1 diabetes on insulin pump. So we included all the patients, also the adult patients who were attending the clinic, who were a total of 70 patients. And we did not exclude any patients. Moving on to the study design, data collection and analysis. So it was a cross-sectional web-based survey. We developed a Google form questionnaire and sent it to the patients. Data collection was done over 3 days after the lockdown ended in Saudi Arabia. And we used SPSS version 23 for data analysis. So moving on to the results. So 65 patients out of 70 completed the survey with an excellent response rate of 93%. And this is the table 1, which contains the demographic characteristics of the participants. So our participants aged 30 years, most of them were female, and regarding the duration of diabetes was 17 years, 0.7. The duration of the use of insulin pump was almost 5.7 years, and the pre-lockdown A1C was 7.44. Most of the patients were on the Medtronic Minimid 722, and some of them were on 640. It's also notable to say that most of the patients were using a glucometer device for blood glucose monitoring. So moving on to the first objective, which is the self-management behavior. So as you can see in this table, maintaining physical activity and ability to follow healthy diet was decreased in the majority of patients. However, adherence to carbohydrate counting, adherence to bolus wizard during mealtime, adherence to bolus wizard for correction doses for hyperglycemia remained unchanged in the majority of patients. It's also notable to say that for glucometer users, who were 34 patients, adherence to self-monitoring of blood glucose 4 times or more per day remained unchanged in 15 patients, but also we noted that there is an increase in monitoring of blood glucose in 16 patients. So moving on to the second objective, which is maintaining diabetes care. So as you know, during the lockdown, we stopped the physical attendance to the clinic, and we initiated phone call appointments. Actually, 26 patients had scheduled phone call appointments, and most of them rated that appointment to be beneficial for their health. 20 patients had no scheduled visits. Appointments were rescheduled for 14 patients, and 5 patients missed their physician phone call. Also, during the lockdown, all patients had an easy access to the physician or the diabetic educator to provide education when needed. And also 24 patients received it. Again, it was considered beneficial. The interaction and the virtual education was considered beneficial by most of the patients. Moving on to the insulin pump supply. So during the lockdown, almost more than 2/3 of the population reported difficulty obtaining at least one type of insulin pump supply. And the highest one was the infusion set, as you can see in this table, followed by insulin, reservoir tube, sensor supply, and also glucometer device and glucometer tools. On the other hand, thank God, when we asked the patient, did you have to use the insulin multiple dose injection, which is either a pen or a syringe, instead of insulin pump due to lack of supply? Most of the patients said no. We had enough supply to maintain the use of insulin pump during the lockdown. So moving on to the limitations of the study. So the study had a small sample size, only 65 patients, due to the limited number of patients. Also, there might be an element of susceptibility of recall bias, since we asked the patients of how they thought the impact of the COVID-19 lockdown impacted their life only 3 days after the lockdown ended. So in summary, in contrast to diet and exercise, adherence to insulin pump behaviors were not adversely affected in most patients. Diabetes care delivered virtually was helpful during the lockdown. 2/3 of the patients reported difficulty obtaining at least one type of insulin pump supply during the lockdown. In conclusion, promoting self-management behaviors for patients with type 1 diabetes using insulin pump therapy is crucial during a lockdown. Telemedicine is a useful alternative to in-person appointments. Strategies to ensure that patients have access to adequate resources during lockdowns must be developed. So that's the end of my presentation. Thank you very much for listening, and I hope you will have a great day. Thank you.